And our keynote speaker today is someone very special who gave us the privilege of having her attend our conference, and that's Lisa Pino. And she is from the U.S. Department of Agriculture, Food and Nutrition Services, and is the Deputy Administrator for SNAP, Supplemental Nutrition Assistance Program. Lisa is an attorney who was appointed as Deputy Administrator of SNAP, formerly known as the Food Stamp Program, as I have to say, I will probably never get SNAP down, but I'm trying. And she most recently served as the Director of Public Affairs for the Bilingual Broadcasting Network in New York and Director of Public Affairs for a college in Arizona. Her background includes extensive service in immigrant and low-income communities in areas such as housing, education, labor, and employment. In addition to law, other experience includes the Florence Immigrant Rights and Accountability Office, the U.S. Attorney's Office, and the Library of Congress. A New York native, she received her law degree right here in Arizona at Arizona State University, and she completed her Harvard University's Executive Public Leadership Program as an NHLI Fellow and part of the White House Project in New York. And so it's my privilege to turn the time over to Lisa. Thank you, Lisa.
Good morning, everyone. How are you? It's a beautiful day in Arizona. Thanks for sharing, Linda. I don't know if my mom would consider me a very important person, but thank you. It's such an historic time for this program and such an historic time for Arizona. And as Linda mentioned, coming back here is like coming home. I spent a good number of years here pursuing my studies and also working in the community. And I say all that because I want to give a special thanks to DES for having this event. I want to give a special thanks to you, Linda, for your leadership, really, in putting this together. And as a former community advocate, I want to give a special thanks to all of you, because you really are the ones working on the front line to help people at a time when times have always been tough for low-income families, but I think we're all feeling the real sense of urgency and the real struggle and how families are struggling to put food on the table. We're here today, and I'm very proud to be part of an administration that is so committed to ending childhood hunger. And you saw the video and the statistics, but we have now over 39 million people in the country on the SNAP program. 39 million. It's really extraordinary. I've been on the job almost about a year, and everywhere I go, regardless of the state or the city, I keep hearing the same thing over and over again, which is, from the state agency's perspective, I have double the caseload and half the staff that I did a year ago. And it's a dynamic that can be felt everywhere. As state budget deficits are looming, layoffs and freezes, as the work that you're doing, nonprofits, as the funds dry out, become more competitive. We're here today so we can figure out how we can provide even more innovative solutions to these programs if there's a way to work smarter and not work harder, and the realization that no one of us can do this alone. We all have to work together. As far as SNAP goes, we're expecting to reach about 40 million people in the country easily this summer, and that number will just continue to increase. So that means that roughly out of every 8 individuals in the country is receiving SNAP. And as you know, SNAP is just one of the 15 nutrition assistance programs that we have. And we talked about WIC this morning. That was a great presentation, by the way, Karen. We also talked a little bit about our national school meals. But let me just give you sort of that national global overview of our programs and where we are. And then let's connect it back to you. And I don't want to talk too long. I think I have until about 10:30. Is that right? So I see some microphones in the corner of the stage, and I'd like to open it up to the floor for questions and the exchange of ideas, because we're also here to listen to you. Our WIC program, as Karen mentioned, reaches over 9 million people in the country. WIC is such an important program to this charge of ending childhood hunger. Let me just give you one statistic that best illustrates that. But there are roughly over 4 million live births in the U.S. every year. Over half of those live births, those children, participate in the WIC program in some form, which is really amazing. And in a place like Arizona, WIC is even more critical. Karen talked about the 65% participation rate. But it's particularly important because it's a program that's critical to serving immigrant communities. And going back to SNAP, the irony here is that although we have this unprecedented historic rise in caseload growth, whoever would have thought 39 million just a few years ago, we're still seeing a very disproportionate participation rate among 3 particular communities. And those communities are seniors, what we call the newly eligible, the unemployed, the underemployed, and also eligible immigrants, particularly Hispanics. And all of these communities are so important, again, to the objective of ending childhood hunger. The President gave the Secretary of our department, Tom Vilsack, the charge when he hired him. His number one mandate when he hired the Secretary was, I want you to provide safe, nutritious, healthy food to children. How are we going to do that from the federal level? Well, Will talked about child nutrition reauthorization. That's something that we have to do every 5 years to ask our friends on the Hill for support, and I'm very proud to be part of an administration that is committed to an additional $10 billion to that prerogative. It's something that we're very proud of. Another tool of how we can end childhood hunger is the First Lady's Let's Move program. I don't know if any of you have taken the time, but we encourage you. The website is www.letsmove.gov. This is a fantastic initiative. What a better spokesperson than the First Lady, because, as Will mentioned, hunger and obesity coexist. That's the great paradox. And that paradox is so true for low-income communities. And, when you look at, again, how we're seeing this disproportionate participation, particularly for minority groups, it's those low-income groups that have, higher poverty rates and minority communities that are facing higher incidences of all the disease that accompanies obesity, right? Higher incidences of diabetes and high blood pressure. And what better, is that me, or I'm standing too close to the mic? I don't know what that is. But, what better way of really implementing healthcare reform than through healthy eating, through wellness and prevention? And these are all tools that we have that we would encourage you here at the local level in Arizona to employ, to share your ideas. The White House is currently taking ideas for what we can do to improve physical activity for children, what we can do to better incorporate physical activity in schools. As mentioned, we're looking at how we can institute better dietary guidelines for school meals. So these are all the initiatives that we're working on at the national level that we hope can better support your efforts. In terms of food insecurity, the IRS, I don't know if you're familiar with this headline, but the Economic Research Service last year issued its annual report last October, and I remember that day very well because I was traveling, and that day, regardless of the airport or what city I was, as I was making my way out west, I kept seeing this headline. I don't know if any of you remember this, but it was 49 million people in the country hungry. 49 million. Actually, what that headline really meant was that 49 million people in the country are food insecure. And food insecurity is a unique term of art. It really refers to the access and availability of food. But when you looked at that report and you looked at, by state, by county, when you looked at how children were impacted by the lack of food insecurity, by being situated, especially like in rural communities here in Arizona, in food deserts, it's really alarming. And it's, no child in this country should ever go to bed hungry, and we really need to figure out how to solve this dilemma. In terms